Welcome back. On today's video we're talking all about how to use this stuff, kinesio tape, in order to strap your knee if you have a torn meniscus. Now the signs of a torn meniscus are popping and pain in your knee. You don't always get swelling with a torn meniscus, but if you're having consistent popping and pain in the knee, then potentially you have damage in meniscus. This can happen from two causes. One can just be wear and tear and degeneration, and over time it gets knackered and potentially tears. And the second is when you've got your leg planted and you get a bit of an injury. So a bit of a push from the side, as you often see in sports like football. So we're going to look at where the meniscus are. If you look at what we call the eyes of the knee, so you've got the bone here, and then you've got the two bits that go inwards. Those are the eyes of the knee. And if you come off that to either side, so the inside of the leg is called the medial aspect, and that's where attachments are, ligaments attached to the medial meniscus, which is basically a cushion in between the two knees. So we're going to feel along here, press along here, see if we feel any pain. And if you feel pain along this side, then you've potentially got a medial collateral ligament strain, or if you're getting the popping, then most likely and pain, then potentially most likely a meniscus tear. And there's several types of tears that you can have, but we'll go into that in another video. So there's lots of different types of tapes as well. You don't need to get expensive types of tapes. They're pretty much all the same. Don't go for the cheapest brand because they don't tend to stick as well. But this brand, which I'll link to in the description box below, is one of the most affordable ones, but is one of the better ones in terms of how long it stays on for. So contrary to what other people will teach on YouTube, the way you need to do this is you need to support the structure that is damaged. So if the medial meniscus is damaged, you want to provide support to that area in order for that area to have a window of opportunity for it to heal. And medial meniscuses do heal, and you can become pain-free if you have this. It doesn't necessarily mean that you need surgery. What we're going to do is cut off a 5 centimeter, around 5 centimeters, so around the length of your little finger, with the scissors, and we're going to cut the tape. So we've got two bits of the tape just there like that. You don't need to do anything fancy. If you think about two poles being stuck together, that's what your legs are like. You've got the bone at the top and the bone at the bottom. And what you want to do is you want to help support that structure. So you've got the cushions in the middle, and if you put the tape on the side where the two bones connect, then you're taking some of the pressure off that cushion and off the ligaments that attach to that cushion on the side where the pain is. So we start, and this is very different to the other videos that you'll see on YouTube, and this is from experience of doing this many times with real life patients who have this condition, is where you've got that line, so you've got the joint line in between the big bone, the tibia and the femur. So where you've got the eyes of the knee, as we talked about, and you've got the line that you feel coming off, you'll feel a little divot in the skin, and that's the line there. Just below that, so we're going to keep that line in the middle of the tape, and below that we're going to expose a bit of the tape like so, so we have an anchor on the skin, so there's no stretch on that part. We're going to put that, and we're going to rub it until it stays. If you've got hairy legs like me, you have to potentially use a bit more tape, or make sure the skin is very dry when you do this. Make sure there's no oil, otherwise it won't stick. And you have to press down really hard if you've got hairy legs. Then you pull, and then this is 100% stretch as far as it will go. This is 50% stretch, and this is 75%, so 75% stretch. Just a minute, and then press that down, and then you need one strap the length of the knee on the bottom and one strap at the top. Just show you what that looks like. I'm going to cut this strap very quickly. And the reason we use these second two straps is to support the knee again, but also as an anchor for the tape. So when we start the tibia tuberosity is the bone that sticks out the front, and then we go round. We're not going to go too far up into the joint because that's going to be uncomfortable. Again, anchor the tape, and then stretch 75%, not too tight around the calf. It shouldn't be really cutting into the skin. You need to back off a bit if it's doing that. It should just be an anchor to that area, and then you want to cover the end of the tape, and that's going to hold it in place. And it's also going to help the alignment of the femur and the tibia. Like so. And lastly, you do the same on the other side. You can, depending on the amount of the medial aspect of the knee that's hurting, you can have two of these going along. So you're covering more the medial aspect of the knee. And then same, starting with a little bit of slack, pushing it on so it goes on to the leg. And then 75% stretch, not going too close to the behind the knee, so that it's not going to get caught when we stretch our leg out. Covering the tape so it anchors it in place, and then touching on. So this is what you end up with. And then you want to extend and stretch the leg to make sure you've got slack, but you'll notice there's no pressure on the patella. The patella can still move freely, but the medial collateral ligament is now supported fully. And that's going to take a lot of stress off that ligament while it heals, and the meniscus. So do make sure you ice the area as well, 10 minutes in the morning, 10 minutes in the evening, and also do your rehab exercises whilst avoiding any aggravating factors. So if sitting cross-legged, if running is an aggravating factor, then avoid those while you're rehabbing the knee, and the rehab will be mostly focused around quad strength to offload the pressure on the meniscus. So I hope that helps, and let me know how you go.